Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest developments from the world of medicine. Childhood cancer survivors who survived cancer and are at a risk of cardiac diseases. Adults who survived childhood cancer have a higher risk of developing cardiovascular diseases than their general counterparts, yet they are 80% more likely to be undertreated for several cardiovascular risk factors including hypertension, diabetes, high cholesterol. This is in accordance to a new research that was published in the Journal of the American Heart Association. Previous research has shown that due to their exposure to chemotherapy and radiation repeatedly, childhood cancer survivors may face up to a 5-fold increased risk of developing heart diseases and even death compared to the general population. Multiple studies have shown that most adult childhood cancer survivors, they report receiving only general medical care, not specific to their experience with cancer. Previous research also suggests that cancer survivors are not receiving recommended cardiovascular screenings in a timely manner due to limited awareness of future health complications by their survivors and the healthcare professionals together. The researchers in the present study, they measured the blood pressure, lipids, glucose, hemoglobin, the A1C levels in nearly 600 adults with an average of 28 years after a cancer diagnosis and obtained similar data on a comparison group of nearly 350 same-aged adults without a history of any known cancer. It was found that cancer survivors were more likely than those without a history of cancer to have hypertension, abnormal lipid levels, and even diabetes. Participants in both the groups had similar rates of underdiagnosed hypertension, high cholesterol, and diabetes. However, cancer survivors were 80% more likely to be undertreated for these conditions compared to their study counterparts. Hence, it was concluded that serious heart disease is uncommon in young adults in the general population, which includes childhood cancer survivors. Therefore, greater awareness of the significantly higher heart disease risk when there is a history of cancer is definitely important. A new invention, which is a nano-sensor which helps detect pesticides on fruits in just minutes. Researchers at the Karolinska Institute in Sweden have developed a tiny sensor for detecting pesticides on fruits in just a few minutes. The technique, which is described as a proof of concept in a paper in the journal Advanced Science, uses flame-sprayed nanoparticles made from silver to increase the signal of the chemicals on the surface. Now, while still at an early stage, the researchers hope that these nanosensors could help uncover food pesticides before consumption. The new nanosensors employ a 1970s discovery known as the Surface Enhanced Raman Scattering, or the SERS as it is commonly known, a powerful sensing technique that can increase the diagnostic signals of biomolecules on metal surfaces by more than 1 million times. The technology has been used in several research fields previously, including chemical and environmental analysis, as well as to detect the biomarkers for various diseases. However, high production costs and limited batch-to-batch reproducibility have so far hindered the widespread application in food safety diagnostics. Now let's look at what the flame spray technology has to say. In the current study, the researchers created this SERS nanosensor by using a flame spray, which is a well-established and a cost-effective technique for depositing metallic coating to deposit small droplets of silver nanoparticles onto a glass surface. The researchers then fine-tuned the distance between the individual silver nanoparticles to enhance their sensitivity. To test their substance detecting ability, they applied a thin layer of tracer dye on top of the sensors and used a spectrometer to uncover their molecular fingerprints. The sensors reliably and uniformly detected the molecular signals and their performance remained intact when tested again. To test the sensor's practical application, the researchers calibrated them to detect low concentrations of parathion ethyl, which is a toxic agricultural insect that is banned for rather restricted in many countries. A small amount of parathion ethyl was placed on part of the apple. This was the experiment that they conducted. The residues were later collected with a cotton swab that was immersed in a solution to dissolve the pesticide molecules. The solution was then dropped onto the sensor, which confirmed the presence of the pesticides. So this nano-sensor technology has proven to be highly efficacious in detecting the pesticides lingering on surfaces of fruits and vegetables. A recent study which unravels why COVID-19 antibody treatments aren't as effective for all new variants. The study published in the Biochemistry Journal is the first to explore the effects of multiple mutations in the evolution of SARS-CoV-2 variants. The findings can help scientists better understand the properties of the current and the new variants. Nearly half of 4.3 million variant sequences that contain any of these three mutations have all the three occurring together. Although individual mutations have both beneficial and detrimental effects, when they come together, these effects get cancelled out, leading to improved selection of the mutations together to act. The researchers found that the three mutations performed very distinct and specific roles that contributed towards improving the virus fitness and builds the case for their positive selection, even though the individual mutations have deleterious effects that make them prone to negative selection. When these mutations they come together, these effects are mitigated due to the presence of compensatory effects. Hence, the authors concluded that the collective effect of these mutations is far more advantageous for virus fitness than the individual mutations, and the presence of multiple mutations improves the selection of these individual mutations. That radiotherapy may not always be needed for early stage breast cancer. According to a new research, it has been found that older women with an early stage breast cancer may not need radiotherapy after undergoing surgery. The researchers said that women 55 or older with stage 1 breast cancer displaying a specific biomarker pattern identifying the luminal A subtype can be effectively treated with just surgery and endocrine therapy. This was presented at the American Society of Clinical Oncology's annual meeting, wherein the research team tracked around 501 patients with luminal A breast cancer for 5 years post-surgery, and they found that the recurrence of cancer in the breast was just 2.3% without undergoing radiotherapy. These findings were an excitement because a certain group of patients were identified who can avoid radiotherapy and its associated side effects and potentially change for the better medical practice around the treatment of breast cancer. Patients with early stage breast cancer typically undergo radiotherapy courses of 3 to 5 weeks to reduce the risk of their cancer from recurring. They mentioned that the overall risk of cancer recurrence following breast conserving surgery has decreased in the recent years thanks to regular mammogram screening, improved surgical techniques, and better systemic treatments. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.